Well, moving on now, poor sanitation is still a major challenge for many African countries, especially in city slums, where the concern of people there is survival.
41-year-old artist Gani Taiwo is changing the face of slums in Lagos with his murals. Neko Zadibe has more on the story.
When nature calls, every healthy human responds. But where and how you respond to that call could be a health risk to you and many others. Today, it is commonplace to find people defecating in open spaces, a practice that is not limited to rural communities alone. This appalling culture is also widely practiced in urban areas where many slums have sprung up and people build houses with no thought for the provision of adequate sanitation or toilet facilities.
Change can only come through the young. And that's why even for Plan, we do try to target children and the young people to actually change people's attitudes, because it is very difficult to change the older people's attitudes. They are used to some of those things. They say nothing has ever happened to them. Like some of them, they say, I've never used a toilet, and yet I'm alive. I'm not dead. I've survived. So what's a big deal? And also you find that the older generation, most of them have also not been to school. And also in terms of issues like diseases, a lot of them believe that probably someone is sick or has died because of witchcraft, not because they were sick.
Though the reasons for engaging in such practice may differ, it does not excuse the negative effects on health and the environment. Open defecation has been implicated in many cases of cholera, diarrhea, among other diseases in the country.
People normally go to the canal to throw their feces. One public toilet is insufficient for the environment here.
Make this one to be numerous.
Before this toilet, the rain would cause floods that would carry all the feces we would throw into the canal back into our homes. There was a horrible acidic smell, and we would get sick from various diseases. I have just come back from the hospital, but my daughter is still sick.
For a populous country like Nigeria, sites like this are frequent, earning the country a second-place ranking after India in countries with the largest number of people who relieve themselves in the open. The United Nations Children's Fund says more than 47 million Nigerians lack access to safe and hygienic toilets. How then does Nigeria plan to reduce that number and ensure that everyone has a safe toilet by 2030? This thought may have crossed the mind of this artist, who has taken it upon himself to beautify toilet facilities in Lagos slums. He hopes to use the colorful murals he paints on the slum's new public toilets to improve the settlement's profile and raise the spirits of its residents.
Everywhere is beautiful in as much as the fact that you can add a concept to it, not destroying it. So I feel like, okay, the Buffy toilet is the public toilet. Let us make it something good, something cool, so that people can even come around, the children around on the street, snap their photograph whenever they're having their birthday parties or the kind of ceremony around there. So they can usually use the walls for all this kind of snapping, background, and those things. So I decided to say, okay, let me use a different dimension.
With people like Taiwo and his organization, the future remains bright in terms of the various innovative ways to eradicate the practice of open defecation and improve public hygiene. Neko Zadibe, TVC News.
Interesting days for public toilets.
Yes, improving public hygiene, like the report rightly said, is important. It's key.
Exactly.